So congratulations on your baby boy. Perfect. So, like I said, I'm going to be doing an assessment. I'm going to start with a full priority assessment, and then I'm going to do a more focused assessment.
Okay.
The postpartum assessment, to see how you're doing, because it's the 4th day since you've had your baby.
Yes.
So I just want to see how you are doing with everything.
Okay.
But before we start, is there anyone else in the house with you?
Just me and my mom.
Just your mom? Okay, so are you okay if we do this in your bedroom just to provide you some privacy?
Yes.
Awesome. Before we get started though, are you able to go to the washroom quickly?
Oh, I went to the bathroom before you got here.
You did? Okay, great. And then are you able to remove your bra?
Yes.
Awesome. So we're in your bedroom. I'm just going to get you to lie down on your bed. And I'll provide you, we already have privacy. I'm going to wash my hands. So I'm going to, or do you mind if I touch you?
Yeah, if you need me to do anything, just let me know.
Okay, perfect.
Okay.
It is a bit of a more personal assessment. I will be, assessing your breasts, your uterus.
Okay.
And looking at your lochia.
Sure.
We'll go through that at the time.
Okay.
First of all, I'm going to just take all your vitals.
Okay.
So I'm going to start with your blood pressure. Okay, you're at 120/79. And then I'm going to check your temperature. You're at 38. It is slightly high. You should be around 36 to 37.5. So I know that you do have an infected episiotomy, which we will assess a little bit later, but that would be indicative of why you have a slight fever.
Okay.
I'm going to check I have my portable OSAT, so I'm going to check your saturation, oxygen saturation. You're at 98 on room air. Excellent. So your general appearance, you're wearing sweatpants. Your hair's in a ponytail. You are awake. You're alert. Your airway is clear. You're able to respond to me. Your breathing is 17 breaths per minute, easy and regular. I'm going to do your circulation now. So I'm going to put on my gloves, sanitize my hands. Actually, I don't need gloves. Because of COVID, though, I would need gloves.
No, I just went before you got here. Everything was fine. Very well.
So if you have any questions throughout this whole procedure, you just let me know in the moment, okay?
Yeah, sure.
And if I'm talking too fast or if you feel uncomfortable, then just let me know.
Okay.
So you can put your arms like this.
All right.
So your arms are flesh toned, warm, excellent.
Mhm.
Cap refill, less than 2 seconds.
Mhm.
Lovely. And I'm going to go down here. Flesh toned, warm, and then cap refill less than 3 seconds. I would then doff, and then I would sanitize. And then I'm just going to check for your any deep vein thrombosis. So I noticed that your legs are symmetrical. You can lift your legs up a little bit.
Okay. Yeah, my feet are kind of swollen.
Your feet are swollen, okay. I noticed that there is no redness in your calf. There's no swelling in the calf. And is there do you feel any tingling or numbness?
No.
At rest or movement?
No, I've been able to walk and it hasn't been a problem. I sit down and then I always keep my feet up when I'm in bed, so no problems.
Excellent. If you're feeling if you're feeling any numbness or tingling or any pain or redness, please let us know to help prevent any deep vein thrombosis. You can also, elevation is great, and also compression socks. Someone may need to help you on with those, but
Okay.
It's a great alternate
Okay.
support. So, if you close your eyes, can you tell me what foot I'm touching?
My left,
Excellent. Now?
my right.
Perfect. And can you point your toes to you?
Yeah, no problem.
Excellent. And can you point your toes to the wall?
Yeah, no problem.
Lovely. And then just gonna see. Tibial pulse is present. Perfect. So you said you had a little bit of edema.
Yeah.
So I'm just gonna press.
No.
So you do have a slight pitting edema. It was less than like 2 seconds.
Okay.
Maybe 2. Excellent. So I'm gonna doff my gloves. Gonna sanitize.
Okay.
And have you, level of consciousness, you are conscious, you're awake. I'm going to ask you a couple silly questions.
Okay.
Can you tell me where you are right now?
I'm at my mom's house.
You're at your mom's house. Sorry, can you tell me your last name?
Sadu.
Sidhu? You already said that to me. And you're at your mom's house, and tell me what month it is.
June.
June. Excellent. The month your baby was born. That's exciting.
Yeah.
And then, so client oriented to 3. Have you had anything to drink today?
Yeah, I had a little bit of breakfast, just like an egg and some tea.
Egg and some tea. Excellent. Did you have anything on the egg?
No.
No, just a plain egg.
Yeah.
And how about, you told me that you voided. And when was your last bowel movement?
Not for 3 days.
3 days. Okay, and how are you feeling?
A little bit full down there and feeling kind of heavy down there, like I need to go, but scared of opening my episiotomy.
Opening your episiotomy. Okay, we will get down there. I will assess that. Please don't be scared about opening your episiotomy. The sutures are very strong and they won't open. I will contact the doctor and get you
I can definitely check up on that when you get to the so you said the pain is
not a stimulant,
does it
stool softener.
Okay.
A stool softener, and with that, it takes about 15 to 30 minutes, but it will soften your stool, so you won't need to strain, and it'll just naturally come out.
Okay.
And then with peri care, have you heard of the peri bottle?
Yes.
Peri bottle, okay. Tell me how you're cleaning yourself down there right now.
Oh, so after I go pee and after I haven't been to the bathroom to go number 2, then I would just squirt the peri bottle on down there and pat that area dry.
And in what direction are you patting?
Towards my bottom.
Perfect. So you're going from front to back. That's
Yeah.
excellent. Continue doing that and continue patting. And you want to use a new tissue with each pat. So you
Okay.
pat and then discard and just do another tissue.
Sure.
That's going to help eliminate any microorganisms or any bacteria from entering that area because we want to get rid of this infection. Okay?
Okay.
Excellent. And then, are you experiencing any pain right now?
No, just the uncomfortable episiotomy.
Uncomfortable episiotomy. Okay, we'll get to that. And then I noticed that you do have a saline lock in situ. So I'm just going to quickly look at that. I would have self-correct, so I would have seen that in the ends. I'm going to assess for drips. There is no drainage at the moment. I don't notice any redness. Is it itchy around there?
No, not at all.
No, not itchy, okay. And is it painful?
No.
Nope. And I note that there's no swelling as well. Excellent. So, safety-wise, I noticed that your place is fairly clean and tidy for a new mom.
Yeah, my mom's really tidy. She does all the cleaning and cooking.
Oh, good. That's awesome support.
Yeah.
I noticed also that the bassinet in the room where your baby is sleeping beside you, I noticed that the baby is swaddled, which is excellent. There's no pillow or other loose articles in there. And
Yeah.
I noticed that it's not by an open window.
Yeah.
And it's not by a vent, so excellent with thermal regulation of your child.
Okay.
All right. So now I'm going to get into the more in-depth assessment, which we need the postpartum assessment.
Okay.
I will be removing little bits of clothing.
Sure, just let me know what you need and I'll help.
Okay, so for the first one, I'm just going to assess your breasts.
Okay.
You've already gone to the washroom. Yes. Well, I'm going to wash my hands. Okay. And you said I could touch you, so I'm using that. So what I'm assessing, I'm going to assess, I'm assessing that your breasts are symmetrical, and they do look symmetrical at this time. They are They do look swollen. They do look a little bit engorged. May I touch your breasts?
Yes.
When I'm doing this, does it feel tender?
No, I just feel full, like firm breasts.
Firm breasts? Okay.
Yeah.
So firm breast is normal. It means that your breasts are engorged. 4 days, they're firm but lumpy. It's an increase of blood flow, and it's before true lactation begins. I note that you are not breastfeeding at this time. You're bottle feeding. When it does feel more tender, it's good to put a cold compress
Oh, okay.
on your breast.
Yeah.
And don't massage your breasts at all. And when you're in a shower away from the stream of the water.
Okay.
Because that will stimulate your nipples, and you don't want those stimulated because that can release a hormone, and more lactation will occur.
Okay.
In about 1 to 2 weeks, your breast should go back. The breast size should go back to normal.
Okay.
Also, one thing to kind of look out for in weeks 2 to 3, you want to watch out for mastitis, which is a bacterial infection. If you're finding that one breast is larger than the other,
Okay.
if there's any redness in the breast area, it'll most likely occur in one.
Okay.
If you're feeling that you have a fever and it's really sore and painful, that could be indicative of mastitis. So you want to contact us immediately, and we can get you on some antibiotics for that.
Okay.
Okay?
Yeah.
But right now they're looking great. How are your nipples feeling?
Oh no, not bad, because I don't breastfeed. I just purely bottle feed, right? So,
Excellent.
yeah.
And, they look great. So
Okay.
we'll do that. Breasts are done. So now I'm going to go down to the uterus. I'm just going to lift up your
Okay.
dress part. So with the uterus, we're checking your fundus. Your fundus is the top part of your uterus. So what I'm looking out for, so I'm just going to put my hand above your symphysis pubis. My other one just above. I'm going to go above your umbilicus. I'm just going to measure down. So when your baby was just born, your fundus would have been just above your umbilicus, but now that we're day 4, it will be 4 centimeters below your umbilicus, which is great. It's normal, and your fundus should be feeling like, there it is, and it feels very firm. It feels kind of like a grapefruit. You know how a grapefruit feels?
Mm-hmm.
So that's a great sign. It means that your fundus is firm. Just massage it. You went to the washroom. Great. This is a great sign. What you want to kind of look out for is, how are you feeling right now?
Yeah, it's kind of cramping, but it's like, that's good, right?
Yeah, cramping is great.
Okay.
It means that your uterus is contracting and recontracting, which is great. If you feel, what I want you to note for is if you're feeling that your uterus is feeling boggy or squishy, that is not the great sign. So what you want to do is you want to massage your fundus until it becomes firm and like a grapefruit.
Okay.
What can happen is that could be indicative of urinary, or it could be bleeding or hemorrhaging out. So we want to make sure. So massage it first, and then you can contact us. Okay.
Okay.
And then at about 10 days, your fundus should not be palpable at all.
Okay.
So uterus location. Great. So now we're going to the bladder. I'm going to note your bladder is not distended. When you're urinating, is there a foul odor at all?
No, not at all.
Do you notice that it's cloudy?
No.
No? Is there any pain or burning when you're urinating?
No.
No? Okay, excellent. So that is great. If at the time you want to look out for, if you're finding that there's foul odor, or it's cloudy, or there is burning, that could indicate a urinary tract infection.
Right.
Again, you want to let us know. We can come and do a culture of sensitivity and get you onto some antibiotics. But before that, we would want to increase your fluids for you. And then, so your last bowel movement was
3 days ago?
3 days ago. So I'm going to assess your abdominal. contour. So yeah, it looks a little bit distended here. So it is not symmetrical at this time because there's a bit distended because you haven't had a bowel movement in 3 days.
Mm-hmm.
I'm looking for any scars. No scars, no lesions. Okay, I'm gonna auscultate to listen. So lower left quadrant, I'm hearing. Upper right quadrant, I'm hearing.
And you said that you were able to.
Upper left quadrant, I'm hearing.
Is that correct?
And lower
And you've been
left
going
quadrant, I'm
30
hearing.
days
Perfect.
every-
Now I'm gonna palpate. I'm gonna watch you as I
Have you been drinking
go.
a lot of water lately?
Yeah, my family's in the
Yeah, that feels okay.
cups of water 1 or 2
I'm
times.
not seeing that my client is not
And how's your diet been
grimacing.
like?
Good.
Good.
So I don't feel any bumps or masses. And we'll get the doctor and talk about the stool softener.
We definitely want to keep that up.
And are you noticing any bleeding when you are urinating or when you have?
No.
No? Okay.
I just noticed that I'm still having like little bits of blood in my pad.
Yep.
Yeah.
Which is, we'll get to that right now. So now I'm going to check your lochia. I'm going to pull your underwear down a little bit. Perfect. So sanitize, gloves on. So I'm going to assess. So we're day 4. So lochia is actually discharge from your uterus. Day 4 it will be pink because it'll be blood mixed with mucus,
Okay.
which I'm seeing, which is excellent. It's called lochia serosa, and this lasts from 4 days up to 10 days. The amount, how often are you changing your pad right now?
Probably because I have that episiotomy infection, I kind of change it every 2 hours even though I don't soak it, just so it's clean.
Okay, okay, perfect. If you're noticing, things to look out for, if you're noticing that you're at this point, if you're filling up saturating your pad in 1 hour,
Yeah.
please let us know.
I will.
And at this, once you get past, so it should be about 50 to 80 milliliters of discharge.
Okay.
After the 1 week, it'll gradually lessen.
Oh, good.
And then past 10 days, it should be, your discharge lochia should be clear or white.
Mm-hmm.
That's called lochia alba.
Okay.
And that can last up to 3 weeks, up to 6 weeks. Okay?
Mm-hmm.
If, one thing I want you to look out for, if you're noticing a bright red discharge in the next 10 days or up to 3 weeks, you have to let us know right away. That could indicate that you are hemorrhaging.
Okay. Yeah.
So please note that. I'm looking at something we also want to assess. I'm assessing the amount, which we talked about, so it'll be less than between 50 and 80 milliliters, but it'll be less going forward after the 1 week. You're going to also want to assess, are there any blood clots or remained placenta parts. Blood clots, small blood clots are okay, but larger blood clots, bigger than the size of a loony, are not okay. That could indicate a complication, so again, you want to notify us right away.
Okay.
So the amount, the color I talked about, and amount, color, I think that's good. And odor. So odor, normal, okay, will smell a little bit musty, kind of like menstruation.
Mm-hmm.
That is normal, you don't need to worry about that. If at all you're smelling kind of a foul odor, that's not good, it can indicate an infection. So just keep note of that as well.
Okay.
At this time I don't smell any foul odor, so this is looking really good.
Okay.
So we're just gonna clean you up, put a new one on.
Yeah. Can you have a look at my episiotomy?
Yeah, that's the next thing
Okay.
I'm gonna be doing.
Great.
So I'm gonna get you to roll over your side.
Sure.
And flex your knee.
Yes.
So now I'm looking at your episiotomy. I do note that there is a little bit of purulent discharge. That looks like yellow to green to brown, and it does look a little bit red. It looks more than a little bit red. There is swelling, so it is healing, but there still is infection.
Oh, yeah.
there.
That's what I thought.
Yeah, so I know that you just took your last dose of antibiotics, I will SBAR the doctor.
Yeah,
Call the
I
doctor
think I need more
Yeah.
because it just,
to get
it's,
you another round
yeah,
of antibiotics.
yeah.
And then while I'm down here, I'm also noting that you have a couple hemorrhoids.
I do. They're so
They're
uncomfortable.
uncomfortable, yes. So the location is by your anus. I see 2, and the sides are fairly small. So what you can do with those, how comfortable are you when you're sitting down?
Sometimes I use one of those donut rings, or I put a pillow
Excellent.
just so it's not hard on my tushy.
Another thing you can do is when you're about to sit down, you can squeeze your butt cheeks together,
Mm-hmm.
kind of sit down, and that can help as well.
Okay.
Do you have a sitz bath?
No, I've been thinking about getting one. Money's a problem, but
Is a problem? I
maybe,
can talk to the agency and see if we can get
sure,
you
yeah,
one, on loan for you.
Okay.
It's great because you can have cool option, water option, and warm water option.
oh, okay,
So it can just help with cleaning, and you just sit on it for about 20 minutes, and then you're good. And then again, pat dry from front to back.
okay,
Another thing, sorry to go back to lochia, if you're noticing no lochia, that's abnormal. Notify us, that's an emergency, so notify us right away. It could mean blood clotting or placenta.
oh, right,
Placenta.
serious stuff,
Yes.
yeah.
Okay, so episiotomy, hemorrhoids. I'm gonna wash my hands. I'm gonna do this. So tell me a little bit about how you're bonding with your baby. With John.
Well, we sleep in the same room. He's in a bassinet, and I find that works really well for our situation. And if I'm too tired, my mom's been really good. She'll pick him up and console him. But there have been times where he keeps crying and crying uncontrollably, and I just can't seem to figure out what he wants. Like, I'll check his diaper, I'll also burp him, I'll cuddle with him, but he's still crying. Is that normal?
The crying is normal. Yeah, it is normal. You can, there's this thing that we have this thing called purple crying.
I heard about that.
Yeah, so I'll leave that with you. It's just the baby, no matter what you can do, might keep crying.
Yeah, it's so frustrating. Yeah, and I'm already on medication. Like it's the worst being left alone. I feel a little bit darker and lower, but yeah. What do you recommend if he starts crying and I can't console him? Like,
at that point, you can let him cry, and that's fine. Talk to me a little bit more about, you're saying that you're feeling a bit dark.
it's just like, when you're by yourself and you alone with your thoughts, and I've got a history of like mental health stuff, and it helps me if someone's beside me and I can talk to them. But with, my mom is like older, and sometimes I don't want to confide in her as much. It's just I feel low because maybe it's because I'm lonely.
Are you feeling that you cry easily?
Yeah.
Yeah? Do you feel kind of happy in one moment and then sort of let down in another?
Yes.
Yes? Okay. And then are you feeling overwhelmed or
Yes.
irritable at all?
Yes.
Mood swings? Okay. So I just want to let you know that this is normal.
Oh.
It's called postpartum blues.
Oh.
And the onset is about 5 days. So you're feeling that right now. And then it's normal and it's temporary. So after 10 to 14 days,
Yeah.
you won't feel this anymore.
Okay.
If, however, you're going into past this time, past 14 days, and going further into 6 weeks, that can be a transition into postpartum depression or psychosis. And we want to monitor for that. So if you're noticing that you're not, you're kind of stepping away and withdrawing, you're feeling that you just don't want to care for your baby anymore,
Oh,
those type of things.
yeah, like it's serious.
Serious,
Yeah.
kind of note that. We can educate your mom as well with that.
Okay.
And
That's really the only thing that I worry about, maybe, is falling into a depression because of my history with mental health.
so do you have a partner right now?
We split up when I was in my first trimester, so we're not communicating. Like, he's not he's not safe to be around, so I've cut off ties there.
And tell me, are you a part of any social groups or do you
I
have a
try.
social network?
Yeah, it was really good meeting other pregnant moms at the public health unit, but now that I've had my baby, it's just hard to leave the house.
Okay.
Yeah.
Are you able to bring the baby with you to like a mom and
I
daughter group?
I could. I think so. Yeah.
Okay. I can get you some resources to kind of look into that.
Okay.
How's your activity level right now?
Right now it's been really kind of just walking a lot in the house and in the backyard and sitting down in the sun if I can. Just really relaxed.
And tell me a little bit more about your sleeping and rest. So,
Oh, with no complaints, because when the baby sleeps, I sleep, and that's what the nurse told me to do is just to kind of be on the same schedule as the baby and make sure that the baby gets something to eat. So I don't have any complaints for sleep.
that's amazing. So you're getting some self-care in there.
Yeah.
And then tell me a little bit more about how often you're feeding your child.
You know what? I heard that it is a good idea to pick up on their feeding, like with their crying and stuff, to check if they're hungry and offer a bottle. But, before I left the hospital, they said every 2 to maybe 3 hours to feed them. So I've just been sticking with that.
Excellent. So I'm noting that the client would respond to her child for hungry behavior. That's great. So also with your baby, it's normal for them to want to feed, as you said, 2 to 3 hours, about 10 times, so 10 times, I guess, during the day.
Yeah, that's normal.
The baby will urinate 10 to 20 times a day. Are you noticing that as well?
Yes.
Excellent. And with the bowel movements, are you noticing it's about up to 10 times?
Oh, no, less than 10, but the diapers have been always like wet and stuff and mushy, so I know he's getting enough to eat.
Excellent. Because you are bottle feeding, it might be a little bit less than if you were breastfeeding, but yeah, that sounds great.
Okay.
He's sleeping, he's crying. So
Yeah.
you're noting that he is getting enough if you're noticing all of that.
Yeah.
Perfect. And then you are taking a medication, and it's for the maintenance of your signs and symptoms of schizophrenia. So it is important you're maintaining taking that every month.
Yeah, and it helps. Yeah.
Excellent. So what you do want to note for, if you're noticing any, they're called extrapyramidal effects, that could be tremors, involuntary movement, or slurred speech. If you're kind of noticing that, then you're experiencing a side effect of the medication and you want to let us know right away.
Oh, okay.
So did you have any more questions for me?
No, just I know I need that shot, and I'm anxious about it because I just want to be around for when my baby wakes up from his nap. So
Yes, totally. Okay, so if you have no more questions, you have our number, so you can contact us. I'll leave you with some resources. Everything's looking really good. I'm going to administer your shot now.
oh yeah, thanks so much.
All right, thank you so much, Anita.
Okay.